Hey everyone, it's Chad North, founder of North by North, with a very short video message to talk about protecting yourself from the COVID-19 virus and using our products as a face mask in order to help you do so. So with the current shortage of protective masks available on the market today, and the priority for the ones we do have to go to our healthcare professionals battling the virus on the front lines, the CDC has actually outlined guidelines for wearing and using DIY or homemade masks as a last resort because they still provide a significant level of protection. And we have some numbers we wanted to share with you. So the data we could find does show that a DIY mask made from a single layer of material, such as a cotton t-shirt, will actually filter out about 50 to 60% of virus-sized particles, even when worn for several hours. And the virus-sized particles they used in these tests were actually 5 times smaller than the current coronavirus we're dealing with today. Now, though surgical masks and the N95 rated masks will filter out about 80 to 99% of these virus-sized particles, the data still supports that wearing a DIY mask is significantly better than the 0% protection you have from wearing nothing at all. If you do wear a mask, masks should be tight-fitting and covering your nose and your mouth, and ideally have a protection that extends below your chin and covers the sides of your face. Now, fortunately, as most of you all know, all of our products can be worn as a face mask, which does provide this full protection and coverage for your whole face. Now, though merino wool wasn't specifically tested in any of the tests that we could find, the fabric that we use is similar in weight and thickness and construction to the cotton t-shirts they did test and approved for making DIY masks out of. However, of all the materials they tested, and they tested quite a few, they all provide at least 50% protection against virus-sized particles, so that's 50% better than 0%. We've included links to the data below this video, as well as the CDC's guidelines for wearing and using DIY masks, and we're also sharing tips from the World Health Organization to help stop the spread of the COVID-19 virus, including what you can do specifically. And below that, we're actually including instructions on how to sanitize your merino wool products. Should you use them as a face mask or for coughing or sneezing into or blowing your nose into, or if you use it as any other kind of protective barrier against the virus, as you can't sanitize merino wool the same way you can other materials. Now lastly, if you have any sewing chops whatsoever, we're urging you to donate your time and materials to making DIY masks for your local hospitals and healthcare centers. As far as we've been able to see, most hospitals and healthcare centers are urging the public to make these DIY masks for their healthcare professionals, so you shouldn't have a problem finding a place to donate them if you need to. If you can't find a place to donate locally, just search online. I'm sure you can find a place online to donate these masks to. You can also go online and easily find instructions on how to make a DIY mask, but we're also including a link to a how-to video below this video in case you wanted to make them. We're actually in the process of trying to get our factory open back up here in Pennsylvania so we can make face masks for the local hospitals and healthcare centers around us. Again, if you can help, please do. All of our healthcare professionals need all of our support to help battle and stop the spread of the COVID-19 virus. We know this is a difficult time for everybody. You know, it's difficult not seeing friends and family or going out to do the things that you want to do. But if we all come together, we can help stop this virus from claiming more lives than it needs to. So in the meantime, please be well and be safe. Thank you for supporting us and supporting North by North through all this and for supporting each other. We promise we'll all get through this together. So until then, please take care.